Of the orthopedic surgeons who specializes in sports medicine at Wake Forest Baptist Medical Center. I think we have an exciting little chat tonight, trying to learn a little bit mostly about the shoulder. We'll hit a number of different ideas and thought processes about the shoulder. This will be sports, this will be different workout routines. So if you have questions, please leave them in the comments and we'll answer these. And please post whether or not you like this or what we could do to make these better, any recommendations. So let's first talk about some common things that we see. So I specialize in sports medicine and especially the shoulder. I did a separate fellowship in the shoulder elbow surgery after the sports medicine fellowship. So what I commonly see, especially nowadays, is many individuals who are young but slowly getting older, and they like to work out, stay fit, and this is fantastic. So they're involved in swimming, playing sports, CrossFit, many activities, even here at our D1 facility, which is part of Wake Forest Baptist Medical Center, and this is where we see patients as well. So a lot of times what I'll see are patients coming in talking about their shoulder being sore, and it'll be a generalized soreness, and when you start to ask them about this, they maybe have not worked out for a while, and then they went in the gym and tried to do a lot of things, or they hadn't swam in a while, or played a sport in a while, and they went and really overdid it that first time. Usually, that's a bursitis, we call it, or a tendonitis, basically an inflammation around your rotator cuff or around your shoulder. And for the most part, that will go away, but it is nice to have that diagnosed by somebody who does see these types of injuries. Another common patient that I see is from the newer working out CrossFit or those types of workout programs. And we're lucky in Winston-Salem because we have a facility like this in D1 that has outstanding leaders and teachers and instructors that know what they're doing and that can keep you safe. But also in the city we have great CrossFit facilities. One of those is with individuals like Josh Coleman at Amplitude. He understands shoulders, he understands how to keep people safe. And I think that if you're going to do these types of workouts, that it's very important to have someone like this at one of these places that can protect you. So I'm going to bring in Stephen here, and I'm going to show you a lot of what I notice when I ask people the types of activities they're doing or the type of working out they're doing when they are not at a CrossFit or at a D1 that has someone like Josh or someone like one of our instructors who can really monitor the technique. So I'm going to bring Stephen in here and show you 9 times out of 10 what happens. So grab a dumbbell there, Stephen. Now do a military with that. So one thing I want to show you is, and he's got a dumbbell, but a lot of times people will do this with a regular bar as well. And what you notice is he's going right up over his head. And that's something that we can do when we're younger safely, or that's something that, you know, maybe college level guys can do. But as we get older, that puts a lot of pressure across your shoulder when your hands are out of view of your eyes. So that's one, I think that I see a lot of individuals who are doing this also when they start using too much weight and it's getting out in front of their body. Puts a lot of stress across the biceps tendon, it puts a lot of stress across your rotator cuff, your superior labrum. So I think that one item or one fact or one recommendation I give usually when I see patients with these types of complaints initially is to modify your activities. And that can simply mean performing your lifting with the dumbbells like Stephen has, maybe on a bench, and you're doing it in a controlled fashion where you can see your hands at all times. If you're doing a bench press, instead of coming all the way down here and putting all the pressure across your shoulders, you maybe don't come down quite as far. If you're doing a lat pull, you don't come down all the way here where you're putting all that pressure across your shoulders, you come down here. If you're doing a fly, you don't come all the way down where you can't see your hands, you just come here. And it's amazing, just with some anti-inflammatories or just with those those activity modifications, how much better people's shoulders would feel. Another thing I would say is, and this is not a negative on anybody, But a lot of times people will have a shoulder issue and they'll go to their primary doctor or a physician who maybe doesn't specialize in sports medicine or the shoulder. And they eventually come to see you if they're not doing well, but you ask, well, what did you do? And eight times out of 10, I bet, they've already received an injection. And that's nothing bad against anybody. They're just trying to get the patient better. But I think that holding off the injection until you see somebody that really knows about sports injuries in the shoulder is wise. And the reason I say that is there's different medications now that can be injected that the literature supports. There's different timing of injections depending on your age and what the injury might be. If you have a rotator cuff tendon tear and you're a younger person, I don't think that an injection necessarily is the best treatment option. When do you get an MRI? When do you not get an MRI? When do you do therapy? When do you not do therapy? I mean, these are all very detailed questions that when you see an individual who understands the shoulder, like our team at Wake Forest Baptist Medical Center, that's the benefit you get from that. I would say that our division is so strong, especially in this region and even in the state, just because we have individuals with the top training. We have individuals that have trained at the top fellowships in the United States in sports medicine. We have some, like myself, who did sports medicine and then trained in an additional specialty, in my case, shoulder. And I really think that adds a whole nother level of care. You know, this is the same group that takes care of most of the major sports players and organizations in this area. If you think about a lot of the teams, we have the Winston-Salem Dash, we're the team doctors, the Winston-Salem Open, we're the team doctors, all of Wake Forest sports at the university, we're the team doctors, Winston-Salem State University, all the sports, we're the team doctors, Salem College, we're the team doctors. So when you start to add this up and you start to think about what it takes to cover that breadth of athletes and the number of sports and the number of injuries, I think that it makes a lot of sense that that's the type of person that you want to see when your shoulder starts to hurt. So let's switch gears. Let's talk about the Olympics. Olympic sports, fantastic. We love to watch them. This is another item. Swimming, unbelievable. It's fantastic. I think it's one of the best workouts that you can do. A little bit different than you might get with the CrossFit. That's more of an overuse type of tendonitis or soreness you might develop. And I think that we can almost use that as a segue into some other sports like baseball or volleyball or tennis that are overhead sports. A lot of times you can get the same type of injury, tendonitis, bursitis, but a lot of times you can get some more specialized types of injuries, such as injuries with your scapula or disorders with your scapula. We would call this scapular dyskinesia. And with a lot of these elite athletes even, we'll see those types of disorders. The scapula, you really want to see somebody that understands those types of pathologies. If you're examined for a shoulder injury, you need to be examined with your shirt off, or if you're a female, you need to have a sports bra on. You cannot see the scapula if you're being examined with your shirt on. And that's an essential part of being worked up for a shoulder problem. That can be diagnosed readily by someone who understands the shoulder, and that can be sent to a therapist, much like right here at D1, a therapist that understands those types of disorders. We tell them exactly what needs to be done, and they can square things away very quickly. So we're going to talk a little bit about baseball now. And the reason that I want to talk about baseball is I was a professional baseball player back in the day. And just so you know, I was drafted out of college, played professional baseball for 7.5, almost 8 years, made the 40-man major league roster for a few years, hurt my shoulder, had shoulder surgery, and came back, reached AAA again with a different organization, with the Rangers, and then retired and went back to medical school. I think that that's important when you talk about throwing athletes, and especially baseball players, of seeing someone that understands this. So in my particular case, I understood not only baseball itself, but understand when someone's injured, or if someone unfortunately has had to have surgery, and what you can expect coming back from that. And I think that benefits all of our baseball players in the region and the professional players we take care of. My biggest concern in this day and age is with the younger players. And I think it's become so competitive, and North Carolina is a state with such great baseball that it's easy to have overuse injuries. And I have a boy, and he's 8 years old, and he plays baseball and Little League, and they have a great Little League and a great team here in town. And I see what's going on with regards to the year-round sports and the year-round, especially in baseball, the travel baseball. The issue I have with that is, it is true, the more that you play certain sports, the better you get at it. But when you start talking about throwing, especially pitching, I think that doesn't really hold true. I think that taking ground balls year-round is not a bad idea. I think that practicing hitting and hitting off a tee is not a bad idea. But I think that pitching is a bad idea. Now, if you really think about it, the big league pitchers, the best pitchers in the world, are going to take a minimum of 2 months off. And if you talk to other experts and mentors of mine who have had some of the greatest impact, such as Jimmy Andrews in Birmingham and now in Pensacola, he recommends 3 months off for the young throwers. So I think that most of the kids of all ages that come into my clinic that are having some arm trouble, the first thing we do is shut them down. And I'm sure there's some parents that I've taken care of their kids watching tonight. And it's a hard discussion, but you have to find a way to shut your young thrower down for a minimum of 2 months. It's not going to hurt his chances of playing college baseball. It's not going to hurt his chances of playing pro baseball. If anything, it's actually going to help him. It's going to make him more effective, and it's going to make his arm feel like it's alive again when he starts throwing. So that's a big push I have. Again, I'm not against playing some type of baseball year-round, but I just think that the pitching, really, you need to put the brakes on it, because being a great pitcher in Little League is not always the best thing for making sure that you're going to continue to play baseball later in life. Along those lines, I'm a big proponent of playing as many sports as you can. And I think that you shouldn't be specializing in a sport until you probably are in your junior year, maybe senior year of high school. I think that playing a number of sports is beneficial. I think that playing the different sports in each season, now again, you can play some baseball in the fall, but you're going to play flag football as well, or you're going to play football, or you're going to play soccer. And playing all these sports, it actually helps you with all the different sports. Your footwork improves, your agility improves, your overall core strength and capabilities improve. So I think that that's the best thing that you can do. I think that big colleges and small colleges and professional teams, they're going to look for athletes. And if you're a great athlete, you can be molded, and you will independently, so to speak, assort into the sport that you're going to be best at. So remember, if you have any questions, please send those, and we'll be happy to answer some of those. And then also, recommendations are excellent for us, because we can always make these videos better. So I think that another question that comes up often, and I have friends in the city, and we'll get texts now and then, when should I see a doctor? When should I call my doctor? And that's a tough question, because I think a lot of us like to tough it out and just say that we're having soreness, and more times than not, that's usually the case. I think if we just talk about a shoulder injury, and we'll stick to that, if you had a situation where you dislocated your shoulder and you needed to be seen in an emergency room, and that shoulder needed to be reduced, as we say, or put back in the socket, then I think that that's something that probably needs to follow up with an orthopedic surgeon or a sports medicine doctor that can work this up appropriately and give you the right recommendations, and at least you're on the radar. Sometimes that means surgery. Most times it does not, but you want to be seen by someone that understands that. Another injury that you commonly have is falling and feeling something tear in your arm, and it just doesn't feel right. You have pain, but you also have weakness. And I think that's a big thing, because as we get older, it's easy for our rotator cuff muscles and our tendons to not be as strong as they once were. And rotator cuff tendon tears are very, very, very common. Now, a lot of people have those, and some people might not even know they have those, but depending on your age and depending on how symptomatic you are, and when I mean symptomatic, how painful is it during the day? Can you, hold a milk carton and grab it out of the refrigerator? Is it waking you from sleep and this is becoming consistent? Is it interfering with your activities of daily living to the point that your quality of life is going down? And I think that when these items start to add up, that's the time that you want to seek out a physician that's trained in this particular field. So as far as taking rests from exercise routines as well, I think that if you have an injury, if you feel that you can continue to exercise, I think that's fine. And I think that over-the-counter ibuprofen or Tylenol is good. But again, if this is something that doesn't go away in a week or so, then that's the time that you want to perhaps see somebody that can work this up further. So again, I think that we're having more individuals come on and watch this little segment on the shoulder and on Wake Forest Sports Medicine. So I'm Mike Freehill. I'm one of the sports medicine physicians at Wake Forest Baptist Medical Center, and we're here tonight and we're just trying to shed some light on sports injuries, especially on the shoulder. So at this point, we're going to wrap things up. I hope that this was useful in some way, shape, or form. For appointments, and you can either see us at CompRehab, or Miller Plaza as we call it now, closer to the medical center, or here at D1, which is an amazing facility as you can see behind me. And I should let you know, a lot of people ask, well, what is D1? They don't quite know. And D1 is actually a multi-purpose establishment that I believe the first one was in Knoxville, Tennessee with Peyton Manning and Jason Witten, and they joined the D1 team. And within this one facility under one roof, you have all the capabilities of different sports. You have the capability of individualized training sessions and workout regimens. You can have one-on-one training, you can have group training, and this is of all different types, taught by some of the smartest and most advanced people in these particular fields. Additionally, you can have physical therapy right here at D1, and you can also see a sports medicine physician here at D1. An interesting fact about our D1 right here is that anywhere in the Piedmont area, no matter what age you are, an adolescent playing soccer to a 55-year-old gentleman playing racquetball, if you have an injury, we see patients here till 6:30 at night. Our last appointment's usually 6 o'clock, and it's an MD you see. You actually see a doctor. You're not coming in to see a PA. Nothing against PAs, but I think that that's a great benefit. You're actually bypassing it's easy to get shuffled around in this day and age, and we all have PAs, and they do a wonderful job. But I think that that's a nice advantage that you have here with this particular sport population, that you can come right in and see a physician that day if you are injured. So for appointments, call us 336-716-WAKE, that will be WAKE, or visit Wake Health, WAKEHEALTH.edu. We also have the Facebook page that you're aware of. And again, any questions, comments, recommendations, we would love to hear from them. Thank you very much for joining us tonight.